Well, joining us now with more on this topic is Kris Litcher-Lee, a nurse practitioner in pediatrics from Gundersen Health System. Thanks for being with us. How important are mom and dad when it comes to modeling healthy eating?
Well, from the day we welcome our children into our families, the habits of a family are key. What is available in the household to eat and drink, when you eat and drink, and what you do with your free time as a family, all that has a huge impact from very early on.
How important is it to start your kids at a very young age on a healthy diet?
Well, we are learning increasingly from studies, from practical experience, that from as soon as you start feeding solid food, incorporating your child into the family mealtime, that is instrumental in just having healthy habits.
What are some of those problem foods that seem to be, making this obesity epidemic worse for our children?
Well, technically, like we adults here, that it is not always so much the exact food, but the quantity and how frequent it is. Certainly kids having a treat, and what we adults define as a treat sometimes can be a stumbling block to healthy habits for our children. But certainly, a sweet treat on occasion, there's nothing wrong with that. But if you as a parent find that that is routinely what you have for dessert or routinely what you have for a snack, then indeed that is something that we in healthcare recommend that families look at and say, is there a balance? And are those things really treats, or has it now just become a habit?
So here's a big one. I'm a parent, picky eaters, and I've lots of parents, my kid will only eat mac and cheese and hot dogs. I want them to eat, I don't want them to starve. What do you do when you have that picky eater?
Well, I think from my perspective, on a regular well-child visit, we discuss growth curves, looking at the trend of your child's growth, their actual length and weight at certain times, but the trend over time. And hopefully that reassures parents that, yes, indeed, my child is on a normal, their normal growth curve, and you can rest assured that it oftentimes is a bit of a power struggle about what's available and what I will accept or what I expect as a child at the table, and if indeed families can just have healthy meals, and this is what we're having, and if you don't choose to eat at this meal, then we'll have a snack at a certain time, but not food in between or the next meal whenever you as a parent think it's appropriate, because it's good. It's really helpful. They're learning, and they learn from us, and if we treat food in a healthy way, they do get some good healthy experiences.
Habits, all right.
Yes.
Thank you so much for your time. We appreciate it. It's okay to let them go to bed hungry. We'll be right back.